Hello everyone, I'm Yusif. I'm a patient consultation expert from Wannabetaller team. If you don't know yet, our team is specialized in limb lengthening, limb deformity correction surgeries, and other orthopedic surgeries and related services in Turkey. In our new video series, we will try to provide information about various aspects of limb lengthening procedure, such as surgery methods, budget planning, traveling from abroad, pre- and post-surgery arrangements, what to expect in terms of height gain results, possible complications, pain and difficulties, and so on. In this video, we will try to put some light on intramedullary systems of limb lengthening, such as Precice nail and its different versions. Let's now go quickly through the history of intramedullary nails. The first mechanical and motor-driven intramedullary lengthening was the first mechanical motor-driven intramedullary lengthening nail was Fitbone, developed by Rainer Baumgart in Germany. It should be noted that a number of intramedullary nails have been developed and applied by other doctors in bone lengthening surgeries. These were mainly mechanically controlled nails with no electronic parts, such as Bliskunov nail, Albizia nail, ISKD, and so on. However, these were all mechanical devices that needed to be activated by patients, either by turning the leg at a certain angle or in some different manner in order to perform bone distraction. And these nails had their own limitations and weak parts. But Fitbone was a good beginning because the nail could be activated from an external electromagnetic device, which allowed for precision in controls. If we compare, this is ISKD. This is entirely mechanical device. It's a clicking nail. Like you click the nail by turning your foot in a certain direction. This is when ISKD is applied to tibia, and this is femur, but the principle is the same. It has a turning mechanism, so when you turn your leg, the internal mechanism distracts the bone maybe a few millimeters or a part of 1 millimeter. And this one is Bliskunov nail. This is also very similar, but it has an arm which goes into the iliac bone, and when you turn your leg, it clicks. It activates the mechanism, so it distracts the bone. So this is how the device itself looks, and it's on X-ray. And Fitbone, as we said, it was not the first nail, but it was the first electromagnetically controlled nail, which could be activated more precisely, and you could monitor the amount lengthened on the electronic controller. It has a display, as you can see, but it still did not see very much approval, but it was a good beginning. Then Precice nail was developed, and it was developed by Yusif company, and it's very similar to Fitbone. I mean, the principle is similar, but Fitbone had this weird part, like it sticks out of the nail and the bone, and you can see here on the X-ray it sticks out, and this receiver, this coupler circular part, was kept under the skin, and when you wanted to do bone distraction, you would put the device on this receiver, and it would activate the mechanism inside the nail. And Precice nail doesn't have that part, as you can see. It's all the nail itself and its screws where it's fixated to the bone. And Precice uses a little different mechanism and lacks that induction coil attachment, I mean the part that sticks out. So these nails allows distraction of the bone in both ways. Like it can shorten the bone and it can also lengthen the bone, because it's a very important feature, because in some patients there might be a need to reverse the lengthening process, like when there is too much tension and there is a nerve pain. Shortening the bone a little bit helps to reduce this nerve tension and pain. And in patients who have poor consolidation of bone, when there is slow union of bone, again, shortening the bone by a few millimeters usually helps bone consolidation, and it increases the speed of regeneration. Last year in 2019, the latest version of Precice intramedullary nail, called Stryde nail, was released worldwide. And the main improvement here is increased weight-bearing capacity. Well, this one, which is the Precice 2 or Precice 2.2, this version wasn't able to support the patient's full weight. So you would need to use a wheelchair. But after Stryde surgery, patients are able to walk throughout the procedure of bone lengthening. Maybe in the first few days or weeks you may require a supporting device such as walker, but later it's possible to walk without support. And let's see how this whole thing happens. Like, it's the step-by-step procedure with Precice 2.2 and Precice Stryde. Like from now on, I will tell only Precice, and when I say Precice, I mean both versions, 2.2 and Stryde nail. So they are almost the same nails, just the main difference is weight-bearing capacity. So the same goes to both methods. Like after the surgery, hospitalization period is usually around 5 days to 7 days. During this period, all necessary instructions regarding operating the electronic controller to distract the bones are given by the doctor or his assistant. Like at first times, the bone distraction is done at the hospital. It should be noted that the controller is provided by the manufacturer to use in the distraction period, and after the end of bone lengthening, the device needs to be handed in. When patients leave hospital, they have two options. Either they return back home if they feel good enough and don't have significant pain, or they can stay here in Turkey for extended periods, usually around 2-3 months, which is the period of bone lengthening, as you can see here. After the hospitalization, we have bone lengthening, which is the most important part. It takes around 2-3 months. And since this is the most critical part of the procedure, patients want to feel safer staying closer to the doctor. And the optimum rate of bone distraction is 1 millimeter per day. However, this rate may be increased or decreased if the doctor thinks it's necessary, and gives instructions accordingly. Precice nail allows lengthening the bone up to 8 centimeters. And it should be noted that in Precice method, patients should not walk or put weight on their legs in any way, because Precice nails have very limited weight-bearing capacity, and the internal mechanism can be damaged easily if the patient attempts to stand up or walk. In this case, the nail would need to be replaced by an additional surgery. I mean, if you put weight on your legs and the nail is damaged, you will not be able to lengthen the bone, and there would be a need for replacement. Like for this reason, Precice patients have to use a wheelchair to move around for this period of bone distraction for several months. And the period of bone lengthening is very similar to other methods such as Holifix, LON, Ilizarov, and it takes approximately 2-3 months depending on the desired height gain. If the doctor thinks it's appropriate to implant nails with a relatively large diameter, then the patient may be allowed to walk with the help of a walker or possibly without support. However, these are possible for some of the patients and depends on factors such as bone dimensions and patient's weight. So like in some cases, in exceptional cases, the doctor may think that it's appropriate to use a thicker nail, and in this case the patient may be able to walk. But generally we would tell our patients that with Precice device you need to use wheelchair. Now the bone distraction has ended and patients are able to walk once again. In first few weeks, a walker or crutches may be needed. In about 1 or 1.5 months after the end of lengthening period, patients are mostly able to walk without support and limping. Like this is our next step. We said hospitalization, and here the lengthening begins. It takes around 2 or 3 months, and it takes another 1 or 1.5 months for walking without support. It makes a total of 4 or 5 months. We have to stress the importance of physiotherapy and daily individual exercises in recovery process. Like these may be true only if you listen to the doctor's recommendations and instructions and do all the necessary exercises and physiotherapy. And it takes approximately 1 to 1.5 years for bones to fully heal. After full recovery, the nails can be removed. The intramedullary nails can be removed, but in Precice methods, as well as Stryde method, the nail removal is optional. The patient has the choice of having the nails removed later or even not removed at all. I should note that the nails are designed in a way that they are suitable to remain inside the bone without causing health problems or corrosion, and they don't beep at security checks and metal detectors. With the development of Stryde nail, patients may walk throughout this procedure as long as they are able to, the whole procedure, as long as they don't have any pain and they can tolerate the pain. Here is one of our patients is performing bone lengthening. It's a little long video, I will not show the entire video. You just put the controller over your leg so that it activates the mechanism inside the nail. So it shows how much of the daily lengthening has been done. Like right now it's set to 0.33 millimeters. It shows the progress. And when it reaches the end, it stops on itself. So you cannot do, you cannot exceed the amount like this that was set. Okay. Let's now move to the next slide and let's speak about the advantages of internal systems. Due to the lack of external fixation, there is overall less pain and discomfort for patients. And there are no open pin sites, which you can see in LON method and other methods with external fixator. The intramedullary nail is placed into the bone and the cuts are stitched and closed, which means there is no way for infection to penetrate and no need to regularly change bandages to avoid infection. When there are no pins and no pin sites, there are also less scars after recovery. And the scars are almost invisible on most skin types, and they are in form of thin lines rather than circular pin-site scars compared to LON, Holifex, Ilzarev. And when sleeping or lying on your bed or couch, you feel much more comfortable because there are no external fixators that would limit your movement. So to summarize, we said almost zero risk of infection because the cuts are stitched, less scars, less pain, higher comfort overall when you walk or sleep or lie on the bed, and no visible external device from outside, so it also looks much better. And let's now move to the prices. At the moment, in September 2020, Precice 2.2 method costs 35,250 euros, and its successor, the latest version, Precice Stryde method, costs 54,500 euros. And compared to fully external methods and LON method, it's definitely much more expensive, but still much cheaper than the same surgery offered in most European and Asian countries, as well as USA. Due to the high prices of intramedullary systems, there are significantly less people who choose fully internal methods for their surgery, but still, for the price of an internal method in Turkey, you get external or LON methods in some other countries, so it's quite a good deal to have the surgery in Turkey. And also, the main reason of the high costs of Precice nails, Precice method, is the expensive intramedullary nails used in this method. So the material cost makes up a significant portion of the surgery price. Like, we mainly pay for the device, it costs very high, so the surgery itself is also expensive in the end of the day. Then finally, I would like to show a few images from our patient gallery. This is right after the end of limb lengthening surgery. As you can see, the cuts are already stitched, and in the second image, the medical tapes, bandages are put over the cuts. Here you can see the same patient X-ray. As you can see, no external device, and this X-ray was taken in the midway, like during the bone distraction period. So there has been some bone lengthening, but it has not ended yet. The procedure goes on. So here it's the same patient where he has already performed around 6 centimeters of bone lengthening. It's a clearer image, so you can see the screws, the mechanism and everything. And this is another patient who increased his height by gaining 7 centimeters on femurs. And this part is where the bone consolidation is happening. So this weird balloon-like shape is bone consolidation, but it hasn't ended yet. When the bone consolidation completes, this part becomes more even and smooth, and like it looks natural. And this is another X-ray where the patient had gained 7 centimeters. This is an X-ray from another angle, from the side of the knee. And this is another patient who is also doing bone lengthening in similar manner. This is all we have for today, and hope this video was useful for people who are thinking about Precice method, Precice Stryde method, or just wants to learn about different methods. and compare their characteristics. To conclude, we can say that intramedullary systems are definitely a big improvement in limb lengthening methods, and they have a lot of significant advantages over external and combined methods such as LON. So as long as you can afford it, it can be a more reasonable choice to choose an intramedullary method rather than external. Thanks for watching, and hope we see each other in future videos.